Welcome to our Conscious Conversation series. I have one of my very favorite people to talk with, Dr. Patrick Lockwood, here on the show today. Patrick, welcome.
Thanks for having me.
Always great being in conversation with you. I'm happy to actually be in the studio. We often do these things on Zoom.
Right.
And so this is a real treat.
This is awesome.
In this episode, we're talking about conscious recovery, which of course is the model that I've created. And we're just going to have an organic conversation about your experience with conscious recovery, anything you want to ask me.
Yeah.
I think the thing that I love about talking with you and working with you is in some ways we come to this work from very different angles or with different sort of backgrounds, and yet we come to very similar conclusions, and I love that.
Yeah, very similar conclusions. I think one of the things I really appreciate about you, genuinely, is this desire to see things in a way that's actually helpful for people, because a lot of the models that have been created in my profession and in psychiatry for all these years, going back to the late 1800s, are very overly simplistic, and they kind of put people in boxes that don't help them. And so I guess, if it's okay, I have a couple of questions.
Sure.
Yeah. So this is more of a high-level question, and I think some people who are watching this may have never heard you explain this, so maybe it's useful for everyone involved, which is, what precisely, like what happened, or what did you notice about the mental health and substance use treatment industry that pushed you in the direction of even creating this?
It's such a great question. And I'll start with when I came into the field in 2008, and then I'm going to tell a little bit of my own story, which gives the background of why or how I created the model. When I started working in the field, the two things that were most striking to me were, one, how many times people were coming back to treatment.
Yeah.
And the program I worked at was substance use, addiction treatment, 48 beds, a lot of activity, let's put it that way.
Sure,
and I was just watching people come back over and over and over again.
Yeah.
The second thing, which is more near and dear to my heart and more the heart of conscious recovery, is I would sit in clinical meetings and hear clinicians speak about and talk about their clients as either broken or through a diagnostic lens.
Yeah.
And that diagnostic lens, in my experience, was keeping people in a box. Now, how this reflects my own story is my earliest memories are memories of being really happy, then shutting down, and then finding drugs and alcohol, which brought me relief, getting sober young at 20 years old, being suicidal at 18 months sober, and meeting a woman who took me on a very deeply spiritual journey of returning to my own true nature.
Okay.
It's a very condensed version of the passion for conscious recovery.
Sure. And so I guess just to pick on one thing you said, which I think can easily get lost if you're kind of casually observing this conversation, which is that when you were in these treatment team meetings, and I run treatment team meetings for a living, so I know exactly what you're talking about, and it's something that I try to do differently myself. And the thing that you said, which is really striking, and I want to make sure everyone can hear this in full detail, which is when professionals specifically talk about patients in such a way that they're simplified and distilled down to a box, right? A simple box, like a diagnostic label, like major depressive disorder or PTSD or substance use disorder, right? This box becomes everything about the person.
Right.
It generalizes. It becomes the most important thing about the person. And I'm sure you have more to say, but just a real quick thing from me that I want everyone to hear is, as a psychologist, what I can tell everyone without any hesitation, very straightforwardly, is that if you think this little box, which may or may not be accurate, it might be accurate in some cases. If you think this is the most important thing about a person, you're wrong. You're just flat out wrong. And when I teach students, I teach master's and doctorate level students about this kind of thing. And every time I have this conversation in class where we're talking about diagnoses and assessment and all these things, you see their mind open and change drastically and immediately. It goes from, here's this simple way of understanding a person, and we all like simple ideas. Simple is good for us. It makes it easier to move throughout our day. But when professionals who are paid to understand a person to help them, in many cases, not die, and you have a simple understanding of them, you're probably missing a dozen or more things, issues, problems, dynamics that person actually needs to address in order to not die, right? So for me, you and I couldn't be more in alignment on this point, that there's no way in the world that if you're in a treatment team meeting and you're a bunch of professionals trying to talk about how to help somebody, and your one thing you're interested in is this person's a drug addict, then you've already failed that person, in my opinion. It's true that people with addiction can certainly have bad cravings and withdrawal symptoms that need to be managed, and it's the most important thing that day, maybe. But the idea that it's the most important thing about how they function in general is absurd. And so I'm curious for you, after that little bit of a tangent there, like, what exactly is it that you think is more important than the box?
Well, I want to actually, well, first of all, thank you, because yes, we're totally in alignment with everything that you just said. And I want to go a little further with it to say that the observer has such a profound effect. And it goes back to my own story. And that is when I was suicidal at 18 months sober, the paradigm at the time sounded something like this: don't worry about anything but not drinking. Your life's a miracle. Now go help someone else. And I was like, that is a really odd response to me telling you I want to die.
Yeah.
Go wash ashtrays. It's literally what they said. That's how long ago it was.
Yeah.
But I realized through my experience of a woman named Mary Helen, who became my mentor for the next few years, it wasn't what she was teaching me, it was how she was seeing me that made the difference. We did deep work, we did trauma work, we did empty chair work, we did role, we did all of that.
Yeah.
But the key thing that was unique to Mary Helen was the way she saw me. She saw past my behavior to like a place within me that was essential. Now, she was a deeply spiritual person. She traveled to India every year. So she had this like deep, very rich spiritual life. So it was all through this frame of there's an essential place within us that's never been harmed. And that opened up a possibility in me that changed the trajectory of my life in such a profound way that when I came into the field accidentally and sort of begrudgingly, by the way, I realized that was my calling. Because of sitting in these treatment team meetings and realizing that there's nothing wrong with diagnosing, but they were seeing them as that. And I knew that that was creating an outcome.
Right.
And I knew that there was a different possibility.
Yeah, I think the idea that there is no brokenness is extremely important, and I know that's a core piece of what you do with conscious recovery, which we'll get to in just a sec. I want to highlight the importance of, especially because probably people listening to this might themselves be in recovery or needing treatment or therapy or something, and so, I think both of us would 100% agree that no human being with a diagnosis is broken. I think the idea that a person is broken is inherently wrong. It's inherently incorrect because it's the wrong metaphor, right? So the way that I describe it when I do family support groups or I do psychoeducation with people is I call that the broken Rolex fallacy, which is, I think, something I came up with. Interesting. I'm not a very creative person, but that's one thing I made, I think. And so the broken Rolex fallacy is where you take a person, a very valuable person. So if you're two parents and you have a kid who's in rehab because they're broken, right? It's like, my kid's a Rolex. And if you've ever seen how a Rolex is made, it's super fascinating. There's all cool Instagram videos and stuff like that you can watch. But the basic story is this super valuable watch, this Rolex, this like $50,000, it's the price of a car watch. If it breaks, you can ship it off to Switzerland and they will meticulously take it apart slowly and carefully, and they record it. And they'll replace every little thing that's broken or scratched, and it will literally look brand new. They can take an 80-year-old Rolex and make it look like it's a brand new version of this 80-year-old Rolex, which is absurd. But when you're buying a watch that's the cost of a car, that makes sense, So in many ways, parents inaccurately believe, or spouses or whoever inaccurately believes, that their loved one is this precious, valuable thing that has to be fixed. Something got broken somewhere that has to be fixed, which is just not true, right? Even if we want to talk about like trauma, which is the easy, trendy topic for everybody, like everyone's traumatized, blah, 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 blah. But the truth is, that's actually not true. In fact, most people are more resilient than they are fragile or something like that. That's actually the truth, right? And that's especially true about people in recovery from addiction. These are the most resilient people on the planet. They've survived being homeless and in fights and stabbed and all these things, and they're still here. They're still kicking. This is the most resilient group of people I've ever met in my life. And so if people were things, we could just fix them. We could send them to an extra smart spiritual person and they'd be fixed like that. You know, if PTSD was that simple, if addiction was that simple, as a thing that got fixed, a computer module that got broken, then yeah, it'd be easy to fix. But the truth is, people are not things. Your brain is not some simple closed system where you just pull out this damaged part of the hippocampus where the trauma is or whatever. The body doesn't keep the score. Nothing is keeping any score. And like, once you understand that the mind is closer to an ecosystem, which is a dynamic and changing and interactive experience, and not a rigid computer or a broken Rolex, then you'll start to see how people have to function differently, and you can't fix them. You can't fix an ecosystem, right? We haven't fixed climate change. We haven't. We've reduced carbon and all that shit, which is great, but reducing carbon hasn't fixed temperature problems because carbon is one tiny variable of dozens of variables that affects the ecosystem that is the Earth. Likewise, addiction is one variable that affects the ecosystem that is the mind. And if you think about all the other variables like friends and family, like spirituality, like metabolic health, like what you eat, like how much you exercise, like how much you sleep, dozens of things all affect this ecosystem that is the mind, and there's no fixing those
Right.
things.
And yet what's interesting is now addiction is classified as a brain disease. Because, you know, we've come so far, and we're both from the Midwest, so
Yeah.
sarcasm is in our DNA.
Yeah,
right?
yeah.
But I'm like, yeah, so now we're much more open now. So we don't say you're an addict or an alcoholic. We say you're disordered.
You're a person with an addiction, yeah.
Right.
Yeah, yeah.
Well, no, we say you have a
disorder, yeah.
Right. So the reason this is important to me, and I agree wholeheartedly, one of the key components of conscious recovery is that we are like a house with 4 rooms: physical, intellectual, emotional, and spiritual, and that we need to spend some time in each of those rooms. And recovery is often focused in my experience, in the intellectual and emotional. And a lot of times the physical, like what are you eating? How are you exercising? What's happening in the body is often overlooked, as is the spiritual. And then of course that room gets very confusing for people because they try to understand spirituality through the mental room instead of the experience of spirituality.
So why did you, back to conscious recovery, why did you choose those 4 rooms?
I chose those 4 rooms because when I read that, because it's an Indian proverb that says we're like a house with 4 rooms, and that we need to spend some time in each of these rooms. What I read is at least to air it out. And most of us hang out in one room or another. It occurred to me that for the most part, the mental health, the behavioral health industry focuses mostly on the mind.
Yes.
And we have traditionally thought that there's a solution to the problem or the broken person that gets accessed through the mind.
Yes.
The reason this is so important to me is my own healing of my own trauma when I realized that so many of the modalities were saying things like change the narrative, change the thinking, have a different thought. All of that is true.
Agree.
But not always useful.
It's not complete.
Because we absorbed and decided things when our brain wasn't even developed.
Yeah.
So my 5-year-old that decided I was stupid, my 6-year-old when I decided I was unlovable and unworthy, I absorbed that, and that became the operating system of my life. And I was trying to say to myself, if I can figure it out, change my thinking, know exactly what happened,
Sure.
that I would be better. And I would go to behavioral health conferences and hear very smart people like you, doctors, delivering information very cerebrally. But then I would see clinicians try to like quote unquote teach clients through that same lens. Let me teach you about the neuroscience of addiction. That might be interesting to a client, but does it actually help them change?
I doubt it. And the reason I doubt it most of the time is because most people, like you're describing, they have a series of issues, or you could even call them filters, through which they see themselves.
Yeah.
So I think one problem that you and I most likely agree on is when we oversimplify people to a diagnosis, we not only miss those 5 and 6-year-old experiences you're talking about, but we also miss seeing the person in those other rooms as well. Because if you, for instance, to be, AA about it, and I'm not an AA, so I'm not speaking from any personal experience, but, AA talks about spirituality a lot. If you read the big book, it speaks extensively about the importance of spirituality. And I think the thing that group is trying to do, I don't know how successfully each group does it, but like, the spirit of what AA is trying to do with spirituality is correct, in my opinion, which is you're trying to have a different relationship with your sense of self that is not specifically focused on your immediate needs, thoughts, and feelings. There's a greater whole that you're a part of. And so higher power, good orderly decision-making, whatever you want to call it, God, etc., I don't particularly care. But the idea that your frame of reference is no longer you, it's you part of a whole, that I think is missing completely from medicine, clinical psychology, psychiatry, everywhere. We are, let's fix my individual brain or my core negative beliefs, which is useful in many cases, but who am I with regard to the world that I'm a participant in? And I'm a tiny participant of these 8 billion people. I'm one of 8 billion. So like, my frame of reference, if it's just my feelings right now, that's a pretty stupid frame of reference in all sincerity, because this feeling is temporary. And it's not even based on anything real 90% of the time. It's based on some historical thing. It's based on some false belief about the world and certainty and all this stuff. We have all sorts of delusions that we would love to believe are true, like everything is great and I'm going to be perfect and all this stuff, which are delusions. They're literally fixed false beliefs that aren't actually based on the data. They're based on some wishful thinking. Sometimes that wishful thinking is because of trauma. Sometimes it's because we're surrounded by people, places, and things that feed that wishful thinking. But wishful thinking is not reality, and it's not spiritual in any way, shape, or form. That's the opposite of spirituality.
Yeah, and with conscious recovery, the foundational principle, and this it will relate to what you're saying, and sort of an interesting pathway to get there. Underneath all addictive behavior is an essential self that is whole and perfect.
Right.
And the reason that I'm saying that right now is I agree wholeheartedly about AA and 12-step and the attempt to connect to something greater.
Yes.
Right, the attempt.
Yeah.
One thing that I think where it can fall short is it stops with find a higher power instead of we are part of that power. Now, if you read the literature, it actually says it very clearly in there. But the culture that's gotten created around it is you need to find God and God's not you. I went to a treatment program and I said, this is many, many years ago. And what I was doing at that time was going to treatment programs and as a spiritual care provider and basically asking CEOs or clinical directors, what do you do for spiritual care? And here's what I can offer you. And so I said to this treatment center owner, what do you do for spiritual care? And first he had a very puzzled look. And then he said, oh, we just tell our clients there's a God and you're not it. Okay, so that's a very concrete and very limited way of seeing spirituality.
I agree.
And for me, the importance of this is to realize that there's an essential part of me that is not only resilient, but it's unharmed and unharmable. And to provide that as a possibility for someone as a starting point is radically different than most models, which say there's something broken about you, as we've already discussed, and how do we fix that? No, I'm not a broken Rolex. There's a place within me, as you said, in your own words, of course, there's a place within me that's essentially whole, the essence of me, the soul of me. And to me, that's the deeper awareness of not spirituality as a search outward, but a returning to an awareness of something inward.
Yeah, I think the inward approach is one that I would agree with, because when we look to the outside world to fix us or to define us, then what we lose is what, the DBT people would call dialectic. Like, there's supposed to be a relationship. And so a lot of these people who are in recovery in particular will find this experience of only looking outside and never trusting something inside ever again, because their sponsor, their higher power, is telling them everything to do. When in reality, I mean, even if you go old school Southern Baptist Christian about it, you're supposed to have a relationship with God, which means there are two parties that are having the relationship. And most spiritual systems have some version of that thing I just described. And so what happens in a lot of these orthodoxies, whether it's the American Psychiatric Association or AA or whatever, is it's not a two-way street for a lot of people. It's a one-way street,
Right.
where it's like you're a radio receiver or something like that.
Well, and to go even a little further, that is addiction.
Yeah.
Looking for something outside of myself to try to fix something, and I'm using that word consciously.
Yeah.
If I feel broken,
Yeah.
that is literally addiction.
Yeah, sure.
Let me take something, let me behave in a certain way, let me shop, let me have sex,
Yeah.
let me do something to not feel this or
Yeah.
to fix something.
Yeah.
So then we get, whether we come to treatment or
Yeah.
go to a 12-step meeting, then it's like the answer's outside of you.
Yeah.
And of course, I want to be clear. I'm not saying there are not answers outside of ourselves.
Oh, sure, yeah.
In addition to that, we want to look at like this place within ourselves that actually has this inner wisdom.
Yeah, I would reframe that just a little bit from my perspective, because of how I show up in this world. And I think one concrete thing, because sometimes when people talk about spirituality or hear about it, they get lost because it sounds ethereal or something. So in the service of talking to the people that are like me who love practical things, so imagine that you have a personality, right? We won't call it a spirit or a consciousness, but imagine you have a personality. So 5-factor model, blah, 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 blah. So if you know for a fact that you're an extremely conscientious person, and you have people around you in the mental health industry or AA or whatever telling you to not be so conscientious, you're telling a bird that can fly not to fly.
Right.
That's absurd. Let that person be exactly who they are, right? If you're more narcissistically oriented, be that person. There's no way that you shouldn't be that person. That's absurd. Now, what you need to do, if you live on any of the personality extremes, be it, 5-factor model or whatever, you have to understand that living in a universe, in an ecosystem that's very complicated, your unique differences aren't going to mesh with every system you find yourself in, every person you find yourself in, so it's a dialectic. You have to have a relationship with the outside world where your unique differences also work with the world around you. Not every environment's good for that. Like, I know for a fact, and we've talked about this, I am not most people's cup of tea. There's no way in the world I will survive in a setting where people want me to socialize or talk or be nice or any of that crap. I can't do it. I'm not built for that. And I found a nice little niche, groups of people who complement me in many ways, that allow me to function and thrive, because I don't need to be all the things. So I don't have to outsource everything in my life, but the things that I'm not good at, the things that I can't do because I'm built differently, I will outsource. And that's what a good relationship looks like, in my opinion. That's what I think healing looks like for people, is finding a series of people, systems that allow you to be connected, but not having to be everything and do everything. Whereas when you get sober in some places, it's like you have to be perfectly good at coping. You have to be perfectly good at going to meetings and talking to your therapist and all this crap. And not necessarily. Not everyone has the same journey. And if you're built differently enough, you're going to have a very different journey.
It's interesting that you say this, and it's something I don't get to talk about a lot. So I'm grateful that this is coming up, at least for me. And that is one thing that sets conscious recovery apart in terms of the group philosophy. Because conscious recovery is a book, it's a workbook, it's a system of care. It's also curriculum, right?
It is.
Curriculum for treatment. And most treatment is built for the social able.
Yeah.
The sociable.
It is.
Or for extroverts.
Yes, it is.
We put people in a circle and we say, okay, Patrick, now tell us your deepest, darkest secret in front of these 22 strangers.
And if you can't.
Then we label you as treatment resistant,
That's right.
disengaged in group.
That's right.
And the truth is something much different than that.
Yep.
Right. So if I put you in a pair and give you basically any open-ended question that allows you to start exploring, you will come alive.
Yeah.
And not only that, but someone like me who is extremely extroverted,
Yeah.
I'm going to have to be uncomfortable. Because if I'm new in recovery,
Yeah.
I'll go back to when I was new in recovery. Even then, I could stand up in front of a room and tell everyone my deepest, darkest secret.
Right.
That was comfortable for me.
Yeah.
But to put me and you face to face and tell you something intimate about me, that was terrifying.
Right.
And so there is something beautiful about being scared and
Yeah.
expanding the comfort zone.
Yeah.
But with conscious recovery, we want to be conscious about providing, and I know you say learning styles is an antiquated system.
It is.
I'm going to stick by it though. And I'm not going to necessarily say it's a learning style,
Yeah.
but I think we all learn differently in some ways, right?
Sure.
There are certain ways that I can access information that you might not. Like
Yeah.
I'm going to talk it through with someone when I have something going on because of my extroversion. You're probably going to go sit with it and then go to your partner or your friend and then share what you came up with.
Yeah. Yeah.
And so like, that's just a different sensibility. Maybe it's not a learning style. So
Yeah.
we want to provide opportunities because I think there's something deeper happening here too.
Yeah.
Shame doesn't heal shame.
Yes.
And I think we honestly live in a culture that celebrates extroversion. I'm an example of that.
Yeah.
You know, I'm fine. I can ride that wave.
Yeah.
But like I remember when I managed a store, the common wisdom was a good salesperson's an extrovert. Not true. I'm going to hire the introvert because the introvert is going to actually be curious about what the customer is looking for. It's profoundly simple. So we live in a world that somehow celebrates the talkative or celebrates the extrovert without realizing that all of it can be welcome. We have now neurodivergence. It's a different way of framing. Our brains are different, right?
Yeah.
So someone's going to, be able to thrive and engage. And the reason I tie shame to it is we can unconsciously cause more shame by putting a person in a position where they feel like they're not able to engage in their recovery.
Yeah, I think one of the big problems with the industry as a whole is that we have very static concepts or very outdated notions of what a person is, this broken Rolex thing, which inherently creates shame. And not only that, if you can basically recognize that people are built differently, whatever that is, whether it's intelligence or personality or spirituality, whatever, I don't care, culture, whatever differences that are significant to a person, if we can just acknowledge those, like one of the reasons conscious recovery is such a useful curriculum is because it's that flexible. It allows people to be different. It allows people to not, because just thinking about this, one of the rehabs that I currently consult for, they have a really good model. What they're missing specifically is this flexibility, is this ability to go, okay, what is different about this person? But then what's beautiful about this particular rehab is they will go find a specialist to go work with this person for specific differences because they recognize that it's not just addiction. Right? You're not just here to detox. You're actually here to start figuring out who you are so that you can do the next thing, right? And so to me, there's a difference between stabilizing a sense of I feel broken, shame, versus healing. And I think conscious recovery is radical because it defeats the idea that there's this linear process of getting detoxed, learning coping skills, figuring out how to do long-term therapy and healing your trauma, and that's it.
Right.
Because that's the current medical model. The current medical model is detox, coping skills, relapse prevention, heal your deeper thing, and be done.
Right. And you're now touching something that I'm most passionate about because we talked about this a little, the cerebral approach. We, and you use the term, so I apologize, psychoeducation. We think we're supposed to teach our clients something. And that's fine, but it only engages the mental room. And by the way, if we're talking about someone detoxing from cocaine, how much are they going to remember anyway? That's
Nothing.
one piece.
Nothing.
But the second piece, and even more important, is I guarantee you, and I know this to be true, I can walk into any rehab in the United States of America, find a client to teach a relapse prevention group and nail it. And yet they're back in treatment.
Oh, yeah.
So what's really happening?
Yeah.
We change through experience.
Yes.
And the experience doesn't even necessarily need to engage the mind. It might, and that might be a part of it. And the reason I'm saying this is, and what I mean by that is, I think sometimes like if I'm in a movie and something profound happens, and then they think they have to have dialogue to tell me what just happened, I just get really bummed by that. Like, I just experienced it. So we don't necessarily need to offer a framework of like, so Patrick, we just did this authenticity group. We had this opportunity for all of us to share at a very deep level because we created safety.
Yeah.
We have the experience, but I don't need to tell you why I just did that or the importance or how it works with helping you heal your addiction or your trauma. It just happened. And so I think what just to be fully frank, and I know you like being provocative, so I'll bring out my inner Patrick.
Join me, yeah.
I'll join you. I think what it pushes up against is clinicians who think they need to be really smart.
Yeah.
And so what if conscious recovery provides an experience, but they're not the one with the answer in the room?
Yeah.
Because I don't think the facilitator should have the answers.
What I would go even further.
Okay, good. Let's go further.
I would say that the need to be smart is only about the clinician ever, because in almost 20 years in the industry, I've never once had an intelligence-based conversation that was helpful.
Right.
I'm a professor, so I spend half of my week basically
Teaching,
knowledge, blah, 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 talking about statistics and research and all these things. And I love it because I'm a nerd. However, I always tell my students when it comes time to talk about treatment and how to deal with patients that no one cares how smart you are. No one has ever cared how smart I was. Right. Even when I do, historically, when I've done like psychoeducation groups, I'm never thinking of it as delivering information in the sense that like I'm a professor sharing knowledge with you. I think of it like having a conversation first and foremost, which means it's both of us on a similar plane, not like a I'm up here, you're down here thing. Yeah. But the other thing that I think about when I do like a psychoeducation group is I think about what does this person or what does this group of people actually need? And it's almost never knowledge.
Right.
It's almost always what I would call perspective. And perspective is different than knowledge. Knowledge is what do the data say? Perspective is a way of looking at things. It's like a lens. It's a colored lens, right? So what I really want to do with people is give them a perspective that's different. I don't care if they retain something about the brain. Most of that's garbage anyways, unfortunately. And if you don't believe me, look at all that we know about mental illness in the brain, and most of it gets outdated in 5 to 10 years and gets rewritten and overwritten and rewritten and overwritten. Very few mental illnesses have perfectly clear neural correlates that are perfect and consistent over time. And so knowing specific things doesn't usually help anyone. Right. However, new perspectives are extremely helpful. And what you're describing them as is experiences that create the perspective.
That's right. And what's key to me, and this is how I describe it when I go into a treatment program and do the one-day conscious recovery experience. First of all, the clinicians think I'm coming to train them on conscious recovery, which is not what I do. We have the experience together, and then I say, what did you notice? What are you aware of? Yeah. What are you feeling, right? Yeah. I often say the greatest compliment that I can ever receive from a client is if they walk out saying, what just happened? Kind of scratching their head because of what you're talking about. Oh, there's a different way to see this. Mm-hmm. There's a different way to see myself. Mm-hmm. What if I'm not broken? What if addiction's not what I think it is? What if it's not just a chronic lifelong illness that can never be healed? What if there's a different possibility? What if my diagnosis isn't who I am, but what I have? What would that create? So in a way, because I've had clients say, that felt like you just manipulated me. And I actually take that as a compliment in a sort of twisted way, because the reason I'm saying that is because, we create a space where people can start to look at things in a different way. I mean, there's actually a specific group about perspective where we literally look at how we see the world and how that creates what we call reality.
Yeah. Yeah, I think there's just thousands of things to say. However, one thing that really jumps out at me is this idea that you use the M word, manipulation. And I think there are a number of professionals, psychiatrists, psychologists, who talk about this explicitly, and I'm one of them. I'm not the only, obviously, but there's this small group of us who actually believe that we are manipulating people. And the thing is, that is what informed consent is. Informed consent, in like the ethical, legal, medical perspective, is you are describing in very specific detail the things you're going to do with a patient to their face and asking them, do you understand
okay? Yeah.
what you're consenting to?
Yeah.
Do you have questions about these techniques? So if I'm going to do ACT with you, acceptance and commitment therapy, do you understand the spirit of it, the values, the hexaflex, blah, 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 and what it's meant to do, right? Do you understand the perspective I'm trying to share with you? And do you understand the goals that we're creating together? That's active manipulation, no differently than doing an experiment together, literally.
Right.
And so healthy manipulation, if you want to call it that, manipulation that's consensual, where we agree to do things together with each other, is different than this Machiavellian, I'm going to do something to you without you knowing it. So like when I supervise interns, I always say, I hate the magician's act that is therapy. I am disgusted by the magician's act that is therapy, because it's like, look over here, but over here I'm resolving your trauma, which is bullshit. It's like, if I'm doing exposure therapy with you, it's not rocket science. We're going to relive this traumatic thing, this memory. You're going to be flooded emotionally, and you're going to learn to tolerate that distress. No magic, no rocket science. A fifth grader could understand it. That is good healing, good clinical work, whatever you want to call it, because it's explicit manipulation. It's consensual. This is what I plan to do, and everybody that I'm talking to could understand it. But the therapists who are full of themselves would like to do something magical. But the beautiful thing about you is when you're doing these trainings for conscious recovery, you're being extremely explicit, as clear as can be. You don't have any secret magic fairy dust. You don't have secret interventions you're doing. Your curriculum is black and white, basically, which is you want them to have a new experience.
Yeah.
You want them, you're very explicit. I want people to not see themselves as broken.
Yeah.
I want them to see themselves as whole. There's no magic there. That's not some profound, I mean, it is for people, unfortunately, because they feel so bad,
Right.
but on paper, it's not magic. It's actually extremely simple.
Yeah.
But for some reason, we overlook the simple for the sake of these deep and profound spiritual, philosophical things, or Buddhist or neuroscience crap that has no relevance to you living differently today. I can tell you all sorts of shit about the brain right now, and it has nothing to do with like breathing differently right now or whatever. You know, like it's just, we love to overcomplicate things because we don't want to be present.
Yeah, and to that end, the essential framework of conscious recovery is so profoundly simple. And it is exactly what you said. What if I'm not broken? What if there's a place within me that is unharmed and unharmable? What would it be like to access that as a starting point? And how then would I start to see myself in the world differently? What are the core false beliefs that carry a frequency that have created what I call reality? And how have I wanted relief from that in the form of what we call an addiction, which, by the way, we don't call it an addiction until it quits working. We call it fun. So when has the fun become not so fun and you find yourself in treatment? That's really, it's so simple. But the other simple piece, and I really, this is what I lean into when I do the one-day experience, I don't even call it a training, is true presence changes things
Immediately.
in a profound way that can happen in 2 minutes, not 50.
Right.
And the greatest recovery tool that a person can experience is to be with themselves. It's not rocket science in any way.
Nope.
And yet, as you said, it is often missed because it seems almost too simple. So if addiction is running from the experience of now, the experience of self in all its complexities, and for many of our clients, they've been running for 30 years from it.
Oh, yeah, yeah.
To be with themselves. But here's the key. I can't, and I'm going to use this word, this language consciously, allow my client to do it if I can't do it for myself. And so I often boldly say, the only thing I need to do, not the most important thing, but the only thing I need to do for my client is my own healing. Because if I am not able to be here with you fully present and allow you to have your experience without manipulating in the not so healthy way,
Right.
or stopping it, or thinking I'm the one with the answer, or thinking what intervention is appropriate. And there, I want to be clear, there's a place for all that.
Sure.
But what we're doing with conscious recovery is, let's also be in that spiritual room, which is, let me be present with you so that we can experience something. You can access something that you're going to be curious about.
Yeah. Yeah, I think being present is the hardest thing for most people, especially professionals.
Right.
And I think you and I have an entirely other conversation we get to have about healing the healers and all this.
Let's do that.
But, generally, I think being present is painful for most, this is my opinion, and this is very biased by my years studying and very vaguely practicing Buddhist kinds of things. So very biased, very much about me. So if I'm projecting, I'm projecting. But I think being present is painful for most people, regardless of culture, regardless of age or gender or whatever, because being present means tolerating something that you don't think you can tolerate,
Right.
which is yourself.
That's right.
And I think we're taught to not like ourselves. We're taught to believe that being selfish is bad. We're taught to believe that we are bad. I think, the original sin thing we can toss in there. I mean, there's so many different reasons, both historically and currently, that people believe that they should be less than, that they should be bad.
Well, and they should be something different or other than who and what they are.
Yes.
And I think that, we could go down, that's a rabbit hole.
Yeah, yeah.
Ultimately, though, through the lens of addiction treatment or mental health and well-being, that's kind of the industry has adopted that. There's something wrong here that needs to be changed, and I'm going to help you change.
Yeah.
And what we're saying is something really different. So I think it's time to bring this particular conversation to a close. So
Okay.
in a moment, I'll ask if you have any closing thoughts. It was fun because we were, I don't know who was hosting this, which I love. I mean, that part's great. But I thought, well, I guess since I started it, I'll wrap it up. But I'm curious if you have closing thoughts. There's so much more we could say, but I always love being in conversation with you because in a way, our minds seem to be somewhat different.
Yes.
And yet we're coming to the same or very, very similar conclusions,
Very
which I
similar.
always love.
Yeah.
We could call this science meets spirituality, which
like that.
I also really love that
I
too.
like that. Yeah, yeah. Yeah, no closing thoughts. Just very grateful we get to do this.
Well, thank you so much, Patrick.
Yeah.
And thank you, everyone, for tuning in to this conscious conversation. You know what? Share it, like, comment, or unlike. I don't, if there's something that we've said that's pushed something, even better.
Yes.
Because there's nothing I love more than someone saying, I disagree, because it allows me to say, let me look at that. And then I'm going to invite you to ask yourself, let me look at that. Peace and blessings, everyone. Thank you.